welcome to Breastfeeding 411. While it may sound natural and easy, breastfeeding is often one of the hardest things a new mom will go through, and I can attest to that. It is difficult and it's hard, and I get it. With my first child I had 10 years ago, it was painful, and it was painful for the first month, and then I got through it, and then it just got easier. With the second one that I just had 9 months ago, oddly, breastfeeding was a breeze. So it can be different for everybody and different for every baby that you have. We have someone that's going to help demystify the whole breastfeeding, saga, as I call it, experience. And we've got lactation consultant and founder of Milky Mamas, which I have used personally, the leading makers of delicious lactation treats designed to promote breast milk production. And I can tell you, with Max, who I just had, it works. So thank you. Crystal Duhaney, just a reminder for everyone else, drop your questions into the chat and make sure it says panelists and attendees, and we will hopefully address it after we hear Crystal talk about all things breastfeeding. Take it away.
Hi, everyone. Thank you so much for tuning in. My name is Crystal Duhaney. I'm a registered nurse, international board certified lactation consultant, mama of 2 with 1 on the way. And I am here to tell you everything that you need to know about breastfeeding, starting from pregnancy and beyond, so that you guys can have a empowering and supported and educated and informed infant feeding journey. First, I want to start off by saying is that there are lots of ways to feed a baby, and how you choose to feed your baby does not affect your value as a mother whatsoever. So use this information to help make an informed decision on the best feeding choice for you and your baby. So let's get started. One of the first questions that I get in regards to breastfeeding for expecting parents is, do I need to do anything while I'm pregnant to prepare for breastfeeding? Or is there anything that I can do now to help promote my milk production? So that's a 2-part answer. The first answer is really no. Your body is getting ready to produce plenty of milk for your baby, so there's nothing that you can generally eat or consume or anything to increase your milk production in a typical breastfeeding journey. Okay, so the best thing that you can do is relax, take a deep breath, and take a breastfeeding course. If you're like me and you've had multiple children before, when I had my first baby, I saw pictures of breastfeeding parents on magazines or on billboards, and they would be holding their babies, smiling, like breastfeeding was the best thing ever. So I figured that would be the same for me. And then when I had my baby, the nurses were like, here's your baby, feed your baby. And I was like, wait, I don't know what to do. So the best thing that you can do for yourself is prepare yourself in advance so that you know what's normal and what's abnormal and what to expect, so you're not shocked when you start your breastfeeding journey. Okay. Also, I want you to know that your body is already producing milk. So around 14 to 16 weeks pregnant, your body starts producing colostrum. You may not leak, or you may, either way is normal, but just know that your body is already doing all the work so that you can sit back and relax. Once you have given birth to your beautiful bundle of joy, here's how you would start getting your breastfeeding journey off to the best start possible. The first thing you're going to want to do, if possible, is do skin to skin. I know that every birth experience is different. So sometimes you may be separated from baby for a bit, or you may not be able to do immediate skin to skin, but do skin to skin as soon as you can. What that does is that triggers that love hormone, that oxytocin that gets you all warm and fuzzy inside. And oxytocin is what tells your body to help stimulate a letdown, which means when your milk comes out of your breast and let your baby know that it's time to eat. Okay, so start your breastfeeding journey, or your first meeting with baby right on your chest. And if you leave baby to their own devices, in most cases, your baby will actually crawl, it's called the breast crawl, right to your breast and latch on by themselves. Of course, every baby is different, but it's really cool to try if you have the ability to. Your baby and your body are in sync. Your breasts have these little bumps. If you're pregnant now, you may notice that there's these little bumps around your areola that are getting larger. Those are your Montgomery glands. and those emit a scent that kind of tells baby to come this way. This is where the food is. You also may have noticed during your pregnancy that your areolas may have gotten darker and larger, and that acts as a bullseye. So when baby is born, baby knows exactly where to go. So keep that in mind when you are just giving birth to your baby, okay? Once you have your beautiful baby, we have what's called the golden hour. Ideally, we want baby to latch on, or we want to remove milk from our breast within the first hour, if possible. Like I said, every birth experience is different, right? So if you cannot latch baby on within that first hour or express milk within that first hour, do it as soon as possible. The sooner the better, okay? So if you choose to latch baby on, because what you hear a lot from me during this chat is that breastfeeding comes in lots of different ways. Pumping is breastfeeding too, hand expressing is breastfeeding too. If you're supplementing, that's breastfeeding too. So there are lots of ways to breastfeed. So you'll hear me make that distinction throughout this conversation so that you're not confused. If you choose to latch baby on exclusively or start latching baby on, it's really, really important that you know how to latch, okay? Although we hear that breastfeeding is natural, right? It doesn't come naturally to us. It's not like you just wake up in the morning and say, I know how to do this. It's a skill that both you and baby need to practice. So I'm gonna go over how to achieve a nice deep latch, okay? So take notes, because this is my surefire way to get a nice pain-free latch. Now, when I say pain-free, let's talk about that before I do the demonstration, okay? Pain-free means that you're not having this toe curling, intense pain with latching. Breastfeeding shouldn't be extremely painful, but it is normal for you to have some sensitivity and tenderness. But your nipples should not be falling off. Cracked nipples, bleeding nipples, not normal, and are usually a sign of either an improper latch or maybe baby has some oral restriction like a tongue tie or a lip tie, all right? But if you think about it, soreness is normal because your breasts are all of a sudden getting lots of stimulation. Your nipples are getting lots of activity. And if you're like me, before I had my babies, no one was touching or sucking my nipples every 2 hours. So now that they're getting all of this stimulation, completely normal to have some soreness or tenderness. If you notice cracking or bleeding though, it's time to revisit that latch and make sure that we're checking with the lactation consultant for assistance, okay? All right, so let's get started. Let's practice latching. If you have a baby at home, you can practice with me. If you don't, again, just take notes, or you can always send me a message on Instagram and I'll definitely go over it again with you, okay? All right, so I got my big boob here. Okay, so, and my baby. The first thing you're gonna notice that I'm doing is I am supporting my baby's, the back of my baby's neck. I'm not pressing on baby's head. You want baby to have free neck movement, but you want their head and their neck to be supported. If you press on the back of their head, it prevents them from opening nice and wide. And we want baby to open nice and wide before we initiate a latch, okay? So I'm just gently supporting the back of baby's skull here. Notice that I'm also resting my forearm against their spine. This helps them feel nice and supported. Sometimes, you know, babies are new to this world or they don't know too much about gravity. So if we don't support them, they may feel like they're falling, and that can make them not relax, which can make it difficult to latch. So make sure baby is nice and supported. For extra credit, you can take their little feet and press their little feet against something. So if you have maybe the arm of a couch, or if you can fit it in your forearm, just giving them something to press or brace their feet against really helps them feel more secure, okay? So that's the first thing. Baby's nice and supported. Also, you're gonna notice that baby's belly is touching my belly. You always want baby's belly touching you. You never want to initiate a latch with baby's belly facing upward, and I'll show you why. If you have baby's belly touching upward, facing upward, the baby has to turn their head this way to latch. It's not very comfortable, right? So like imagine I have my water bottle here. If I have it right in front of me, super easy to take a drink. If it's over here and I have to turn my head, That's not so comfortable. So keep that in mind when we're latching baby, okay? Belly to belly. All right, now let's talk about our breast. When we're latching baby on, although it's called breastfeeding and we often think that baby's sucking on our nipple, they're actually latched onto our areola. Our areola is the circled part here around our nipple, okay? So we don't want baby latching onto our nipple. We want baby to have a nice open wide mouth latched onto our areola. It's a common misconception that baby has to get all of your areola in their mouth because we all have different anatomies. Some people have really large areolas and some people have tiny areolas. So we just want baby latched onto our breast tissue and not our nipple. Remember, we breastfeed, not nipple feed, okay? Alrighty, so now that I have my breast here, I am going to have my baby belly to belly, right? Supporting the back of baby's skull. Sorry, baby, let me turn your head. Supporting the back of baby's skull, not their head. And I'm also supporting my breast here. Keep in mind that I'm supporting my breast behind my areola. I'm not here squeezing the nipple. A good way to keep that in mind is you're gonna take 2 fingers, put it right here at the base of your nipple, and that'll give you an idea of where to put your thumb. See that there? So you're gonna take 2 fingers, put it right at the base of your nipple, put your thumb right where that ends, and that gives you a good idea of where to place your thumb. You're then gonna take the rest of your fingers and just wrap them under your breast, okay? Next, what you're gonna do is you're gonna gently compress your breast down, okay? Imagine your breast like a sandwich. If you have a really large sandwich, it's very difficult to get a good bite of that sandwich or get a lot of that sandwich in your mouth. But if you squeeze that sandwich down, it's much easier to get a good amount of that sandwich in your mouth. So we're gonna make a breast sandwich with our breast so baby can get a good amount of our breast tissue in their mouth, okay? Next, what I'm going to do, and I'm going to turn this way so you guys can see, is I'm going to align baby's nose with my nipple. That's very important because you want baby to open wide. And if you align baby's mouth with your nipple, they just have to open a tiny, tiny bit because your nipple is right there. But if you align baby's nose with your nipple, then they have to open wider in order to get their upper jaw over the top of your nipple, okay? And that helps promote a nice open wide mouth. All right, so belly to belly, we're making a breast sandwich, squeezing our breast, right? Then what we're going to do is bring our baby to our breast, okay? So I'm gonna gently compress and I'm going to tilt my breast upward and I'm gonna rest it right here on the top of baby's upper lip, like on their Cupid's bow. Putting pressure right here is a signal to baby that it's time to eat and to open wide. Once baby opens wide, this is very important. You want to wait until they open wide because if they don't, it's going to hurt. And I promise you, you're going to have to restart the latch. So just be patient, right? Once baby opens wide, you're going to drop the bottom of your breast into their bottom jaw. And you're going to do a little scoop. You're going to scoop baby up and over the top of your breast, of your nipple, so that they can get the top of your areola into their mouth. You see how that is? That should be relatively pain-free. Once babies latch, it should feel like a tuggy pulley, not like a pinchy, bitey, sandpapery, if that makes sense, okay? Tuggy pulley is okay. What you should also see is you should see baby's chin buried into the bottom of your breast. And you should see that there's a nice gap between your breast and baby's nose so that their airway is nice and clear. You should also see their upper lip is either lightly flanged or neutral. We don't want their upper lip tucked like grandpa, okay? If it is tucked, you can just take your thumb and just kind of flip their upper lip up to kind of flange it out. If they have trouble keeping that upper lip lightly flanged, then I would recommend maybe getting it checked by a lactation consultant just to make sure there's no restriction there, okay? Once baby's latched on, you should start seeing them do their, I'm gonna show you guys with my little puppet here. Once baby is latched on properly with their lips lightly flanged, You'll start seeing them suck really fast and really shallow. That's called nibbling or non-nutritive nursing or suckling, okay? They're not actually getting milk right now. They're just suckling. And what this does is it provides nipple stimulation to help stimulate your letdown. Your letdown is when your milk comes out of your breast. Some of you may feel it, and it's described as like a tingly kind of pins and needles, maybe. We all have different feelings of letdowns, and some of you may not feel it. Either way is normal, okay? Once your letdown starts and your milk starts flowing, baby's nibbling will transition to a longer, wider suck. Can you guys see that? So their chin will drop for about half a second, and that means that they're taking a big gulp of milk, and then it'll close. So longer gapes and close, longer, instead of this nibbling. Throughout the nursing session, they'll kind of go back and forth between nibbling and longer gapes. If you start noticing though that they're just nibbling and not really actively nursing, what you can do is take your hand and just compress your breast. That will squirt a little bit of milk in baby's mouth to say, hey kid, remember that we're eating. let's keep on task here, okay? Each nursing session varies. It depends on your baby, but your baby should be nursing for about 10 to 25 minutes, sometimes a little longer. If you find that you've been attached to your baby for an hour and then you unlatch and baby's screaming hungry, that could be a sign that baby didn't get a lot of milk during that session and they're still hungry. So you want to make sure that you're kind of keeping an eye on how long it's taking baby to finish your nursing session. And also you want to keep an eye on if they're satisfied, okay? So that's latching. If you guys have questions, please send me a message. Remember, soreness and tenderness is normal. We all have different pain thresholds. So soreness and tenderness for me may be pain for you, but what we don't want is cracked, bleeding nipples. We don't want pinched nipples. We don't want your nipples to look like a fresh tube of lipstick where they have that pinched tip after unlatching. Additionally, we don't want pain throughout the entire nursing session. The soreness and tenderness is okay and is normal and expected right in the beginning with that initial latch, but once baby gets going and once the nursing session has been established, that pain or soreness and tenderness should subside, okay? Another important question is, how often is baby gonna eat? Remember, your newborn is growing very rapidly, okay? So they're gonna wanna nurse very, very frequently. In the beginning, they go through what's called cluster feeding, okay? And that's gonna feel like you're attached to baby all day. It's gonna really feel like you have a lot, like you've been just nursing and breastfeeding all day. For the first couple of days, sometimes even a little longer, your entire life is gonna be feeding baby and helping them grow, okay? Completely normal. After a while, your milk supply will regulate after the first couple of weeks or so, and baby's nursing pattern may change, but baby goes through frequent growth patterns and growth spurts throughout their life where they may start cluster feeding again and they'll want to nurse more frequently. So the best thing that you can do is watch the baby, not the clock. Feed your baby on demand and not on a schedule. Does that make sense? Okay. Another important question I get is, how do you know if baby is even getting milk, right? Because when we're breastfeeding, we can't see the milk going in. We can't see how much they're taking in. So it's kind of a mystery. So here's how you know if baby is getting plenty of milk. For the first week of life, meaning from newborn to day 7, baby should have at least one wet diaper for every day of life. So when they're 1 day old, they should have one wet diaper. And by wet, I mean urine. When they are 2 days old, they should have 2 wet diapers at least, and so on. By day 7 and here on out until the end of time, they should consistently have 6 to 8 wet diapers per day. That's a good sign that they're getting plenty of fluids. If it's not coming out, then it's not going in, right? Additionally, by about day 4, depending on the type of birth that you had, if you were separated from baby, those types of things, their meconium, which is that dark green poop that they have as a newborn, should transition to a yellowish seedy poop, okay? And it should be nice and soft. If that's happening by about day 4, sometimes day 5, then that's a great indication that they're getting plenty of milk during that first week. Another thing that you can do for extra credit in that first week, and I love this tip, and this really helps getting your breastfeeding journey off onto a right foot, is that after every nursing session, you're going to hand express. I encourage every breastfeeding parent to learn how to hand express because it's a great way to remove milk and it's free. So to hand express, what you're going to do is you're going to grab your breast, you're going to gently compress and squeeze backwards into your chest wall, compress forward and release. And you're going to do that a couple of times, and then you'll start noticing that your colostrum, if it's the very beginning, or your milk, your mature milk, which is the whiter, creamier milk, comes out of your nipple. And you'll just keep doing that. And that will help if you do that after every nursing session and collect your colostrum on a spoon or in a medicine cup and feed that to baby after every nursing session, like dessert after a meal. If you can remember, that will help make sure baby's getting plenty of milk. It also stimulates your milk production and make sure that you guys get off to a good start. So if that's one tip that you can have after giving birth, I recommend that because it's a really great way to get things going quickly, okay? Alrighty, so that's our first week. Let's talk about weight loss. It's expected or considered normal for your baby to lose about 7 to 10% of their birth weight right after birth, okay? So don't let that freak you out, but you want to make sure that baby is still meeting all of those signs of getting enough milk that I mentioned to you. By about day 10 to 14 after giving birth, your baby should be back to their birth weight. If you're noticing that their weight is still declining and their diaper output is declining, or they're not having bowel movements, or their bowel movements are formed and not soft, those are indications baby is not getting enough milk and you want to get help right away. And you'd likely need to supplement to make sure baby is getting plenty of milk. Remember, there's nothing wrong with supplementation, okay? Supplementation and breastfeeding is breastfeeding too. So if you need to supplement in the beginning, just until you get things going, that's okay. But make sure you work with a lactation consultant to make sure that we're maintaining our supply when we're supplementing baby, okay? So now let's say you've decided that you don't want to nurse, you'd rather pump, or latching is too difficult for you and you just would think it would be easier to pump. Exclusively pumping is an option, and it's breastfeeding too. Feeding your baby breast milk, no matter how you do it, is breastfeeding. So let's briefly talk about exclusively pumping right after birth. So right after birth, your body's making that thick antibody-rich colostrum that we call that liquid gold, right? It's super thick, and sometimes most pumps have a difficulty removing your colostrum from your breast. So if you start off pumping right away, you may get a little discouraged because nothing's coming out. So what I recommend right after birth is to hand express. So you're gonna hand express every 2 hours or so, and then follow that with a pumping session. Hand expression will help remove the colostrum or milk from your breast, and the pumping will help stimulate your milk production and stimulate your breast to make more milk. So we're gonna do that for about the first 4 days or so until your milk volume increases or until your milk comes in, as we like to call it. Okay, there's nothing wrong with pumping, and it's a great way to supply milk for your baby. If you choose to pump in addition to nursing, you can do that too. However, keep in mind that any extra breast stimulation that you're giving to your body is telling your body to make more milk, and that could lead to an oversupply, which isn't as fun as it sounds, right? Okay, so one of the most important things if you choose to pump, or if you plan on pumping at any time in your breastfeeding journey, which a lot of us do, especially here in America where we have to go back to work super early, unfortunately, is to make sure that your flanges are the right size. If you're like me, when I was a new parent, I just took the pump out of the box, plugged it up, and started using it. I had no idea that flanges, what they were, and that they needed to be fit for me. But you have to keep in mind is that every body is different and we all have different anatomy. So flange sizing is one of the most important tips that you need to know if you're gonna pump at all. Okay, I'm gonna show you how to do it. Alrighty, So we have our breast, right? And we remember our brief little anatomy lesson from earlier. Areola, nipple, okay? So we're gonna take a measuring tape. It can be this one or any one, and you're gonna measure just the width of your nipple from here to here. Can you guys see that? I know you can't see the numbers, it's super tiny, but just giving you the idea. You're gonna take that number and convert it to millimeters. And you're gonna do this before nursing or pumping, okay? And whatever number you get, so let's say I measured in inches, okay? So if you measure in inches, just take that number, type it into Mr. Google and ask them to convert it to millimeters. So let's say that you got 13 millimeters for your measurement on this breast. You're gonna add 3 to 4 millimeters to that number, and that will give you your best start with your flange sizing. So adding 3 to 4, I get about a 16 to 17 millimeter flange. That's what I'm gonna start with on this breast. I'm then gonna measure this breast. The reason why is because your breasts are sisters, they're not twins. It's very normal for you to have one breast that needs one flange size and another breast that needs another flange size. So make sure you measure both, okay? Then you're gonna go and buy those flange sizes, and that's the flange size you're gonna use. You're gonna test it for comfort. Is it comfortable? Is your nipple rubbing against the inside of the flange where it's causing friction? Is your areola getting sucked into the flange? That might mean your flange is too large. What's your milk output like? Has it increased or decreased? That's how you can determine what your flange size is like and if it's the right flange size for you, okay? One thing to notice though is that if you're measuring right after giving birth, a couple of weeks after giving birth, your hormones will regulate and your nipple and areola size may change. So it's a good idea to measure every time you notice a change in your milk supply, or maybe every couple of months, just to make sure that you're using the right flange size, okay? All right, so we talked about pumping and nursing for that very first week, okay? Now let's talk about what do we do after the first week? How do we maintain our milk supply after that? For the very first week, you wanna make sure that you are pumping or nursing about every 2 to 3 hours or on demand, and that will help maintain your milk supply and make sure that you have a wonderful breastfeeding journey.
All right, I have a question for you. And I
Yes.
think this comes up a lot is how do I know that, when I pump, for me personally, when I pump, I get about half an ounce out, but I also have a healthy growing boy. So when I breastfeed, I get about 4 ounces per boob. Is there a correlation between pumping and output of breastfeeding from the boob?
Yes, so do you mean like when you nurse, you get a certain amount?
Yeah, so I've weighed him before I nurse and then
Okay.
I weigh him after just to make sure, because when I pumped, I literally get drops out for some reason.
Okay. So when you're pumping, there are so many things that go into pump output. Flange size, like I mentioned, if you're using the wrong flange size, which most parents are, then that can affect your pump output because it's like having a bad latch. It can't remove milk from your breast effectively. Additionally, if you're stressed out while pumping, like most parents are, if you're staring at the bottles while pumping, I know that you all do it. I know that you do it, Vina. You stare at the bottles while you're pumping. That makes your body really stressed, increases your cortisol, and you kind of tense up. If you just take a nice deep breath and relax, you'll allow your body to relax and your letdown will come faster. So stop staring at those bottles. Additionally, know that your baby in most cases is more effective at removing milk from your breast than your pump. Because again, there are so many factors that affect your pump output. Also, you want to make sure that your pump parts are in good condition. Those need to be changed about every 30 days or so, depending on the type of pump and how often you pump as well. You also want to make sure that you're massaging your breast while you pump to help remove as most milk as possible. So I would say don't worry about your pump output, especially if it's after nursing. The average pump output after nursing is about half an ounce to 1.5 ounces combined. That's both breasts together. If you're replacing a nursing session, the average pump output is about 2 to 4 ounces combined.
So a couple questions that have come up. Do you need to supplement vitamin D drops if you're breastfeeding?
That's a great question. So although breast milk is just amazing, it's really, really amazing for baby, it doesn't have a lot of vitamin D. So there are a couple of ways that you can supplement vitamin D, especially if you live in a state that doesn't have a lot of sunlight, or if you have darker skin like me where you don't absorb a lot of vitamin D from the sun, you can either take 6,400 international units of vitamin D yourself. There's studies that show that if you take that much, that you would supplement yourself with enough to supplement baby through your breast milk, or you can buy the drops of vitamin D and drop them into baby's bottle, drop them on your breast before latching, or those types of things.
Perfect. I know one of the big questions that comes up too is if I'm not, but if I was pregnant and I am nursing a toddler, does that affect the fetus that's in my belly? Is it safe? How long
Yeah,
can
that's a
you do
good
it?
question. So in most cases, again, this is a question usually for your healthcare provider because you want to make sure that you're not high risk. But a general rule of thumb is that if you're safe to have sexual intercourse while you're pregnant, then you're safe to breastfeed. Because the reason that they say not to is because when you are breastfeeding, it causes that oxytocin to flow and it causes some uterine contractions. Same uterine contractions that you may have during intercourse. So if you're cleared for sex, you're cleared for breastfeeding. And you don't need to stop. You can continue nursing throughout your breastfeeding journey as long as you're cleared by your physician. And then once you give birth to your baby, your body is so amazingly smart that it knows that you have a newborn. So you'll make colostrum for your baby. I've even seen new parents make colostrum on one breast and mature milk on the other breast for their toddler.
That's amazing.
It is.
Is amazing. I know another thing that comes up a lot is, sometimes, at least I had this with Max, who I had 9 months ago. I had a plug duct in my armpit, which was really awesome. Almost,
Yeah,
I would say right when I came home from the hospital. What are some great ways to either know that you have a plug duct, get rid of the plug duct, or know that you're on course for mastitis, and what do you do?
Plug ducts are no fun. Usually they have a cause. So what I usually tell parents first is, let's work on treating it, but then let's work on treating the cause so that we don't get them again. So usually plug ducts are caused by infrequent or ineffective milk removal, meaning that we didn't nurse enough, or we didn't pump enough, or we didn't do it effectively. So we didn't remove milk effectively. Sometimes you can also get them if you're wearing a really tight bra. If you are wearing like maybe an underwire bra and just putting pressure on a milk duct, that can sometimes cause some plug ducts too. A couple of things that you can do to relieve them are massage. I love massaging. It really, really helps. Vibration, anything that you have that vibrates, wink, wink, or a mechanical toothbrush that you have, you can put that on the area. Warmth, like a nice moist heat can really help. Dangle nursing or pumping. So basically you would be on all fours where your breast is hanging downwards, and then you would nurse baby would be laying on the floor or so, and you would nurse that way or pump that way and use gravity to help dislodge that clog. You can also take sunflower lecithin, which has been shown to help emulsify, which is like break up the fat that's causing that clog. And you can take that and that will help dislodge the clog as well.
Amazing. Well, I think that's all the time that we have. And I know that we could talk about feeding baby and breastfeeding for forever. But just as a reminder to everyone watching, we are recording this, so you can definitely get more information. But if you want to talk to Crystal more, which I know all of us do, you can find her on Instagram at Milky Mama LLC. So if you need more about the ins and outs of breastfeeding, totally DM Crystal and she will answer more than all of your questions. So thank you so very much.
Bye guys. Take care.